Medical term, Abbe-Flap. Definition: the Abbe-Flap, also known as the Abbe-Flap, is a surgical technique used in reconstructive plastic surgery to repair defects of the lips, particularly those caused by trauma, tumor resection, or congenital abnormalities such as cleft lip. It involves transferring a full-thickness flap of tissue, including skin, muscle, and mucosa, from one lip to the other, while maintaining its blood supply via a pedicle. Key features. Purpose: to restore both functional and aesthetic integrity of the lips. It is often used to reconstruct one lip using tissue from the opposite lip, upper or lower. Procedure: a pedicled flap of tissue is taken from the donor's lip. The flap is rotated and sutured to the recipient area. The blood supply is preserved via the labial artery, ensuring tissue viability. Common uses: repairing central lip defects, addressing cleft lip deformities, restoring oral competence, ability to seal the lips properly, recovery. After healing, a secondary procedure may be needed to divide the pedicle and finalize reconstruction. This procedure is named after Dr. Robert Abbe, who first described the technique. It remains a cornerstone in reconstructive lip surgery. Med term, Abbe-Flap.